Hi, I'm Andy Miller. I'm the Executive Vice President for Mission at Livestrong. So we wanted to spend some time today recognizing that it is National LGBT Health Awareness Week and talk a little bit about the specific risks and challenges that being lesbian, gay, bisexual, or transgender bring with it in regards to either having cancer or developing cancer at some point in the future. So there's been a lot of research that's been done that describes the risk behaviors for LGBT, especially LGBT youth, that put them at increased risk for cancer. Things like smoking rates, alcohol use, obesity, all tend to be higher than the general population, and for a number of reasons. Increased stress and how do you deal with that, as well as targeted marketing from the tobacco and alcohol industry to get the population to use their products, all of which really are known risk factors for cancer. And whenever you have groups that are using more of those products, you're going to see a higher risk for cancer. So access to services is really one of the areas that can put the LGBT population at increased risk, not only for maintaining good health that could put them at increased risk for cancer, but also in accessing services if they fear they may be facing a diagnosis, or if they are diagnosed, getting into treatment. LGBT population tends to be, in terms of wage earning, lower than the general population. And so sometimes being of a lower socioeconomic status, you will find that access to health care will also be lower. They may have a higher risk for being uninsured. And certainly, if they are insured and are partnered, do their companies provide partner benefits? And so an individual may be insured, but their family might not be insured. So they're at greater risk for not having coverage. And then certainly, if they are diagnosed, fear of discrimination within the healthcare system is real. People need to be able to be who they are and disclose all of the relevant information about their life in order to receive the highest quality of care from their healthcare professionals. But if someone feels like they may be judged or that they may be discriminated against because of their sexual orientation, they may not feel exactly comfortable telling someone all the information they need to know. So it's really important for one, lesbian and gay community to know that there are resources out there that can help connect you to insurance coverage, as well as how to help you select the best provider that's going to provide you with the best care. For LGBT cancer survivors, Livestrong has created what we call the Coming Out with Cancer brochure. And what it does is help you to know which questions to ask your healthcare provider, what are the issues that may be relevant for you post your cancer experience, and then connect you to those resources that can help you to meet those challenges. And we also have our navigation services. So you can go online at livestrong.org or call our navigation services through our toll-free number and get some assistance in connecting to resources or dealing with challenges that you might be facing. And that's true for anyone affected by the disease, not just post-treatment cancer survivors. So if you've just been diagnosed, if you're a caregiver, a friend, family member, and want to help someone or seek services yourself, feel free to go online or pick up the phone and call our navigation services. And we can connect you with those resources that are appropriate for you. We also have our Livestrong guidebook that can help you to organize your information and to record all of the information that's relevant for you so that you can share that with people who are providing you care. And that includes information about being gay or lesbian and what that means for your goals for care.